I'm Patrick M. Flaharty, MD, and I am the Medical Director here at Azul Cosmetic Surgery and Medical Spa. Today we're going to talk a little bit about facial fillers. There's perhaps no topic more hot in the field of facial aesthetics than facial fillers, and for good reason. There is a number of new fillers that have been approved by the FDA that are now available for our use in rejuvenation of the face. One of the things we've become very familiar with in recent years is the fact that loss of volume and loss of fat from the face really leads to a lot of the aging changes. Hollowness under the eyes, sunken droopiness of the brows, hollowness through the mid-face, and of course the lines increase as we see around the mouth, which very often are a result of loss of fat from facial movement. These areas can all be dramatically improved with simple in-office procedures with facial fillers. The original filler approved by the FDA was collagen back in the 1980s. And that has become a little bit passé now because we have now much better and longer lasting fillers. The fillers we use most frequently here at Azul include the hyaluronic acid products, and that is a large category of products of which we primarily use Restylane and Juvederm. Those are the trade names for two hyaluronic acid products. Those work extremely well. The reason hyaluronic acid is an important filler is that it is a clear gel-like protein that has a high affinity for water. So when we inject this into the tissue, whether it's into hollowness under the eyes or folds here, it'll layer out and fill in the defect or the hollow area, and it'll retain water and give you some natural plumping to that tissue, which looks very good. So in our hands, we use most often Restylane, which I find to be the most user-friendly filler. And I'll use that for frown lines between the brows. If Botox alone doesn't smooth these frown lines, we'll put a little bit of Restylane in. We use it under the eyes quite a bit to fill in hollowness and dark circles, as well as into the mid-face to give us a little more fullness to the cheekbone and fill in the mid-face hollowing. And we certainly use it for lips, lip augmentation, filling in lines and creases, softening at the corners of the mouth. Now, for patients who are a little older, where the creases get to be a little deeper or the folds a little heavier, such as nasolabial folds or labial mandibular lines, it can really get to be heavy. We move on to slightly different fillers. The one I use most often around the mouth is called Radiesse. This is a different filler because it is thicker. It has a solid component and a liquid component. The solid is calcium hydroxyapatite or calcium phosphate microspheres, and these are floated in a gel, and when we inject those beneath the skin, it can fill in that deficiency and depression and actually lift the corner of the mouth. This is again done right in the office, very simply done with some numbing cream and a little bit of ice, and I find that gives us a more dramatic effect for the heavier folds here and at the corners. In many cases, we'll use more than one filler. We'll use maybe the Radiesse to fill the heavier folds here and here, the Restylane for the hollowness under the lines and the fine lines and creases, and of course we often will use Botox as well for the frown lines between the brows, the forehead, and around the eyes. And so you can see when you can address all these things with a single treatment in the office, you can really achieve a dramatic rejuvenation of the face all through these procedures, which would take less than 30 minutes here in the office.